Hello everyone, welcome to another episode of Skin Biology with Dr. Hephzi Tagoe. It's week 5 and today we are talking about the biology of eczema, one of the most common childhood diseases globally. What can we do about it? Stay tuned, and after the break we are going skin deep to understand the biology of eczema. Be right back. Welcome back. What is eczema and what triggers it? Eczema is a chronic inflammatory skin condition. Chronic being it's long term, so it doesn't go away. Inflammation is basically when your immune system is trying to fight off a dysfunction in the whole body makeup, and so in doing that it can get excited sometimes and produce a lot more defense mechanisms than it needs to, and in doing so causes things like itchiness and redness and discomfort at the site where your body is trying to fight off a malformation or a dysfunction. Scientifically, it's referred to as atopic dermatitis. Dermatitis to do with dermal, so the skin, and atopic, it's a word collectively used to describe conditions from reactions of your immune system. So things like asthma would be atopic, things like food allergies, things like hay fever, and of course eczema as well. But what causes it and what will determine if one person is going to get eczema and the other person it's not? Most people inherit it, but there are other triggers that can also lead to onset of eczema in adulthood, mostly environmental factors or your diet. Now, genetically, there is one main gene that we know, once it's mutated, exposes someone to eczema, and that gene is filaggrin. It's a protein that is also required in developing your skin barrier function. So once filaggrin is missing or it's mutated, it basically causes miscommunication in the whole skin formation process, and in the body's defense of trying to fix it, it leads to the external characteristics that you would observe in the form of eczema. Can you cure eczema? Not exactly, but you can reduce the extent of inflammation. After the break, we are going to look at some simple things that we can do to help restore your skin barrier function. Stay tuned. So how can we treat eczema? Unfortunately, we still haven't found a cure for eczema yet. It can be managed, and there are several ways of managing it. A lot of the treatments for eczema are topical based, meaning that you actually have to apply some form of cream on the skin surface, whether it's a prescribed one or it's just paraffin based emollient that you are using. Keep applying this regularly, and over time it will help restore the skin barrier function. Regular steroids will be quite mild in concentration, and so although they do have side effects like thinning your bones or thinning the layer on the skin, it can be used to help restore the barrier function. But in extreme conditions, you may be given either antibiotics to clear the triggers of the inflammation from the inside out. 5 simple tips that I can give you to help minimize flare-up of the eczema. One is moisturize a lot, so like 3-4 times a day. That dry skin side needs to keep having moisture on it. Also wear comfortable clothes so they're not so tight and the skin can't breathe. It's advisable to use moisturizing soap rather than the more harsh regular soaps that that are out there. Certain things that you may be allergic to that you may not be aware of can also trigger your eczema. Swimming pools usually do also cause a flare-up. That's not to say if you have eczema you can't swim. You just need to be aware of that, so you apply the right emollients anytime you've had a swim. And lastly, look at your diet, see what you need to cut out, and just be healthy. I hope you found this useful. Eczema can be managed, so don't stress about it. Thank you once again for joining me on another episode of Skin Biology with Dr. Hephzi Tagoe. Don't forget to subscribe, like, comment, share, and keep bringing in those questions and comments and topics that you want to be covered. Join me next week for another episode of Skin Biology with Dr. Hephzi Tagoe.